Welcome to Vet Ranch. I am Dr. Matt. This little dog is, we're calling her Mama. She was picked up recently. She's had a set of puppies pretty recently, we assume. And she has an eye condition. She's a little skittish. Doesn't like us messing with her eye, but basically her top eyelid is rolling in, and you can see how this eye, her right eye, is very blue. That's from chronic irritation. And watch how I can roll this eyelid out a little bit. But it's rolling in, all the hairs are rubbing right on her cornea, causing her a lot of irritation and pain. And this is going to need to be surgically corrected. So we're going to go ahead and anesthetize her, and we're just going to take a little sliver out up here. We may try to open up this eye opening a little more too, because you can see it's a lot smaller than the left side. We're going to see what we can do for her, and see if we can patch her up and make her a happier, more comfortable dog. So take her to surgery right now. Here's that right eyelid that's rolled in. And it's kind of hard to tell what's going on now, but watch how much I can roll this skin out. All this hair is sitting there rubbing on the actual cornea. There's the normal edge of the eyelid right there. That's how it should be. So we just have all this extra skin in here. And I'm going to basically just make a big wedge up here, take out all this extra skin, and hopefully that'll be enough to keep that hair off the eyelid. You can see how blue that cornea is. It's all irritation. There's a little bit of black over here, a little scarring just from that chronic rubbing on the cornea. Where we just removed a wedge of skin above this eye. So now when it closes, we're just going to close that right down there, suture it together. So there should be enough tension pulling this up to keep that eyelid from rolling in on the eyeball. All the sutures in the upper eyelid here, and it looks like it's holding it pretty well from going in, rolling in on that eyeball. So hopefully this will work. Sometimes you need to go revisit these and take another little bit out, but we'll see how she does over the next couple of weeks, and she should heal up pretty nicely. All right, it's about 2 hours after the surgery. She is looking pretty good. That eye is already trying to roll in just a little bit, but there's so much swelling that you really can't say that it's going to work or not right now. So we'll just have to see. It's definitely an improvement. The hair on the top of that eyelid is not touching her cornea anymore. She's obviously a little painful and holding it closed right now. But we'll hopefully be able to get her back. She's going to a foster home right now. Hopefully we can get her back in and see how she looks in a couple weeks after all the swelling goes down. She may need a revision on this. It's hard to know right now. We'll just kind of have to watch her and see. All right, here she is. It's been about 3 weeks since the surgery. Coming real close here. We just now pull all the sutures out, and still looking pretty good. It's rolling in a little bit right there in the front, but no hair is touching her cornea, so she's been doing a whole lot better since she had the surgery. So we're just going to kind of let her go like this and just kind of watch her and see how she does. But anyway, thanks for watching Vet Ranch. Thanks to all who have donated and helped us fix these dogs, and we really appreciate it, and we'll see you next time.
I know what you're going through. I know, 'cause I've been there too. And I don't walk right, and I don't talk right, and there ain't nothing wrong with feeling strong.